this is Dr. Shouri. I welcome all of you to 89th birth anniversary celebrations of Dr. Hammer. Disclaimer. The information given in this presentation is for educational purpose only. Participants shall consult their medical doctors for health reasons before using anything that is disclosed during the course of this presentation. Students shall not use any of the different information given in this presentation while writing their exams. My sincere gratitude towards Father of Homeopathy, Dr. Christian Friedrich Samuel Hahnemann. He says, only freedom for prejudice and tireless zeal avail for the most holy of the endeavors of mankind, the practice of true art of healing. We strongly believe that homeopathy chose us into its family, and I am thankful to it. I would like to introduce a great man, Dr. Reich Hammer. He is a German physician and the originator of German New Medicine. This is known as a sacred medicine. It is a holy spiritual worthy of awe and respect. We consider Dr. Hammer is instrumental for beginning of a new and important period in history of the medical science. He guides us to an understanding of diseases and be free of fear and panic. Here comes my guru, Dr. VS Reddy sir. He is a homeopathic physician since 30 years and an organic farmer, a nature lover, successful doctor treating many patients throughout the India and also abroad. He introduced German new medicine for me when I came to my clinic and joined there. Since 4 years, I'm being practicing the GNM and counseling many patients regarding the principles of GNM. My guru gave me this rebirth in my soul. I'm always thankful to you, sir, for being a spiritual teacher and a guiding light in my life, as well as many patients. An inspiration person in my life, Dr. C.J. Verghese, sir, who is a GNM mentor and a homeopathic doctor. Thank you, sir, for giving me opportunity for sharing the knowledge of GNM to many people. A short intro on myself. I am Dr. Shouri Venkateshwarlu from Warangal, Telangana. I work as assistant doctor to Dr. VS Reddy, sir, at Dr. VS Reddy Homeopathic Center. I have 4 years of clinical experience in homeopathy. I got graduated from Barkatullah University, Bhopal. 4 years of learning in GNM and have presented 2 seminars on Germanic healing knowledge. About my topic, I choose to say the role of limbic system and internal hormone changes during the conflicts and healing phase. I would like to say what a human being is and a humanity is. The great Bhagavad Gita says, blessed is a human birth, for true knowledge and pure love may be attained only by the human being. The word humus means earth and the homo means man. The man comes from the earth and also goes to earth back. Introduction about my topic is the conflict, and during the conflict, what are the changes going in the brain? What is a conflict? An unexpected, highly acute and isolating conflict shock that occurs simultaneously in psyche, brain, and also the corresponding organ. Conflict is an emotionally distressing event that we could not anticipate. We are not prepared for the situation, what is going to happen, so that is called as a conflict, and the person is not at all aware of what is going to happen. GNM uses a word as biological conflict. It means the shocks in life, and I would like to say what the mechanism going in the brain and the limbic system and in the endocrine system. You need to understand what are the nervous system functions. Nervous system is divided into central nervous system and peripheral nervous system, as you can see. So the afferent division is when you receive the signals from the stimulus outside, and the organs, the sense organs like skin, your eyes, the vision, and ears, your hearing, all these will be received to the brain through the afferent division, afferent nerves, and then the processing will happen in the brain, and brain in turns will send signals to the efferent division by which the action is completed. And the efferent division is divided into somatic and automatic and also the enteric nervous system. The somatic system is of skeletal muscles like hands, legs. These are all voluntary things, what we can do by our will and wish. The autonomic nervous system is instant thing what is happening, and the body itself will do its function by itself. That is, they are present in the smooth muscles, cardiac muscles, exocrine glands, and some endocrine glands also. The enteric nervous system is completely about the digestive system of our body. When we talk about the conflict in GNM terms, the limbic system of a person is more active, and it is a quick reaction of the body or a person to the stimulus or to the conflict what the person is experienced. So the two parts of the limbic system which are more important is amygdala and also the hippocampus. I would like to say information about our clinic and my sir. Our sir has been treated many COVID patients during the time of COVID. So here the scare fright and the flight or fright response has been more active in the people who are most vulnerable to be attacked by COVID virus. So the amygdala and the hippocampus are the two main things. What the hippocampus have of the all people did is they received the information from the media and also like WhatsApp or Facebook or news channels that COVID virus can kill the people. So what happened in our clinic, as a strong follower of GNM, our sir has been introduced to all the people that fear only kills, but not the virus. So he has given the strong will and also the courage to the people that virus doesn't do anything. So in our clinic, there are nearly 10 people who are working. We have given many services to the people with which we have caught them and also touched them. We have given the medicines because our sir has introduced the term that virus doesn't kill. So everybody's hippocampus has been changed in our clinic. So we are already prepared that it doesn't kill us. So the amygdala didn't react when the COVID patient entered to our clinic also. We didn't react. What amygdala does, in general, people who are strongly believing that COVID is going to come by sneezing or by coughing or by standing nearby, so their amygdala will react very quickly and they will feel that they are going to get COVID with very small, minute touch. So the fear enters in the body and they become weak, and that is helpful for them to get affected. So what a limbic system does, it is involved in our behavioral and emotional responses, especially when it comes to the behavior we need for survival, feeding, reproducing, and caring for the young ones. Mostly the limbic system, the amygdala is the main part which is used for fight or flight responses. All the emotions like anxiety, aggression, or fear, emotional memory, and social cognition regulates the autonomic nervous system by the hormone production and release. Secondarily, affects the blood pressure, heart rate, hunger, thirst, and sexual arousal and circadian rhythm, sleep-wake cycle. The hormones and the endocrine system. The endocrine system uses the hormones to control and coordinate your body's metabolism. So, as you can see, in complete body, there are many glands. So, the pineal gland, the hypothalamus, pituitary gland, thymus, thyroid gland, and parathyroid gland, the pancreas, kidney, testis, uterus, ovaries, adrenal gland, and liver. So different kind of hormones are released from the different systems. So they are regarded as say chemical messengers which are involved in the transmission of information to different tissues from one cell to another. They are helpful for energy level, reproduction, growth and development, and the responses during the injury and stress and environmental factors. So hormones are very much important which play the role in reactions of the person during any phase. Dr. Hammer says our personality is sum total of our biological conflicts. His findings state that constellations have a significant influence on development of a person's character and behavior. What we say like mental illness is caused by the social and emotional factors such as how the children are experiencing the trauma, how they are exposing to the violence in the family or in the school, their lifestyle crisis and the relationship problems or a low socio-economic status. I'm more into the schizophrenic constellations in this video, which means the person is conflict active with two biological conflicts that correspond to the both hemispheres of brain. The combination of the conflicts determine whether the constellation manifests itself as a delusions, abnormal movements, obsessive thoughts, or compulsive behaviors, or manic depressive condition. The degree of the mental state and constelled behavior of a person is directly proportional to the intensity of conflict. The conflict experienced more will be the effect of the mental state of the person. As I told you, a person's behavior is depending upon the social and emotional factors, how his emotions are affecting him and his body. You can see here the different lobes of the brain. This is a frontal lobe, this is a temporal lobe, occipital lobe, and parietal lobe. Occipital lobe is used for the visual effects and visual stimulus, and the parietal lobe is decided about the language and sensory input about the language. This is the vernix area. This understands about the speech. The posterior parietal cortex, which is used for the sensory and visual input. The somatosensory cortex for the sensations, and the primary motor cortex for the voluntary movement of your hands, of your legs. Supplementary motor area on the inner surface for the programming of the complex movements. The premotor cortex is for the coordination and complex movements between the all voluntary organs. There is a prefrontal association cortex, which is a higher brain. We say this is most important thing that we should learn about the prefrontal cortex, which I will explain you in the last. This is used for planning and voluntary activity, decision making, and personality traits. The Broca's area in the brain is used for the speech of that particular person. When it is used to cry, when it is used to argue with a person or used to fight with a person, the Broca's area is used. The primary auditory cortex, which used for the hearing, and the limbic association cortex. This is the most important thing for the emotions and memory of the people. So today I'm explaining about how GNM explains why, for the instance, some people become a perfectionist, a show off, a compulsive talker, a procrastinator, a homebody, or a loner. We would like to say when we introduce about our friends, like she is an arrogant person, she is a calm person, so he is a follower, he is a dominant. So some people are tidy and over punctual, and some people are messy and they are late. They are chronically late and unorganized. And some people are too aggressive. So, and the people who are depressed will be having the suicidal tendencies and the emotional remoteness or withdrawal from the society. Few people won't speak in the people, they can't be associated with the groups in the people, and few people are immature, and we can learn and understand from the perspective of biological conflicts why a man becomes a womanizer and why a woman becomes an nymphomaniac, why the people men are becoming effeminate and why the woman is acting mannish, and the homosexuality behavior also. Human behavior is solely shaped by our environment, socially, culturally, and conditional genetic. The brain, the psyche, and the corresponding organ always unified organism that always work in the synchronicity. So here are the few examples of different conflicts faced with the people during the small childhood phase and also to the aged people or the elderly people. This is a girl who is sitting sad because her parents are fighting, and a boy who is shocked and bewildered when those parents are fighting. After growing up and she joined in the school, all are criticizing and talking about her. So she will be depressed. And these are the people I have seen a girl coming to our clinic. She says that she's attracted to women only, not men. So the adolescence attraction of same gender. And people who are doing work are being insulted by colleagues or criticized by the job employer. The people who are in the nymphomanic or Casanova state, they are cheating and lying, who are fighting, who are having the sexual conflicts and abnormal sexual behaviors. There is a wife who is abusive and always scolding his husband, and there is an aggressive husband who is constantly beating her wife. And here comes a girl who is entreating and begging his husband. There are many pregnancy depressions also which impact directly on the people who are directly on the fetus who are inside. The elderly people who are being abandoned by the children and who are thrown away to the roads. So the thalamus and hypothalamus are the parts of brain which are very much important in emotional response. So your thalamus is an egg-shaped structure of the brain. It's the relay station of all incoming motor movement. The sensory information like hearing, taste and sight and touch, except the smell, from your body to the brain. The hypothalamus is a structure deep in your brain. It acts as your body's smart control coordinating center. Its main function is to keep your body in a stable state called as homeostasis by controlling the body temperature, hunger and thirst. It does its job by directly influencing your autonomic nervous system or by managing the hormones. So Dr. Hammer clearly says in biological laws that about normotonia, sympathictonia and vagotonia. So what is a normotonia? When a person is in a balanced state of day and night rhythm, then the person is said to be in a normotonia. And in a conflict active phase, when the person is entering in a conflict active phase after the Dick Hammer syndrome, that is a shock, then he is having nervous restlessness, the fast heartbeat, and the BP, raised BP, slow digestion, and frequent urination, and little appetite. When you touch the hands of such people, they'll be very cold, which cold sweats. So the psyche is in a compulsive thinking mode. They will be always dwelling of what happened to them, so that they are having the sleep disturbances, waking up at around 3 a.m. in the morning. So the extra waking hours is to resolve the conflict what is happening to them. So they'll be in a focus to find a resolution to subside the conflict. And when the conflict is resided, then the people are entering into the healing phase that is known as the lasting vagotonia. What is the lasting vagotonia? This is a state of healing phase where the person is having a prolonged state of rest. That means he is having the fatigue, good appetite, slow pulse, and low BP. Blood vessels expand, causing the warm hands and warm skin. Here, the psyche is in a state of relief. The person who had entered into the healing phase will have a relief here. Resting and desire to eat provide the organism with the necessary energy for the healing. There are different kind of hormones based on the classification of hormones. There are amine hormones, steroid hormones, peptide hormones, protein hormones, and glycoprotein hormones, and miscellaneous. For example, we can take the luteinizing hormone, which is released from the pituitary gland. It stimulates the release of an egg from the ovaries during the menstrual cycle. So it is said about the female. Hormonal status are very much important in males and females to regulate their functions and also used in growth. After certain sensory input from the environment, the central nervous system directly stimulates the hypothalamus And hypothalamus will release certain releasing factors which in turn directly enters to the anterior pituitary and posterior pituitary to secrete certain type of hormones. So the hormones releasing from the pituitary of anterior side is corticotropin and thyrotropin, follicle stimulating hormone, luteinizing hormone, and growth hormone, prolactin. The posterior pituitary secretes the oxytocin and vasopressin. They show their actions on many tissues like muscles, liver, reproductive organs, mammary glands, smooth muscles, arterioles, kidney, and heart. I'll make you understand the topic by giving an example of a 26 years female. She has in nature like simple, creative, and too emotional and sentimental. She fond of affection, never revengeful but attached to nature. She loves plants and animals. She said she is a workaholic and affectionate and easily melting towards other sorrows. It means her limbic system is so much active than her prefrontal cortex. So there is no analyzing about others or others' behavior, but she easily melts towards others and helps others, serving others despite of other her own needs. So she doesn't care about herself. It means that prefrontal cortex is not deciding actually according to her age. So the physical complaints she has been said is hair loss, retarded height growth, and obese. She has a premenstrual syndrome and low backache, breast tenderness, scanty menses of only 2 days flow, an age looking, acne on her face, and a recurrent mouth apthy. The dorsum, cervical, and lumbosacral pain and finger joint pains of sometimes. And her mind symptoms, which was said by the attenders, she gets easily hurts and weeps, and she shouts at them and yells sometimes. She gets offended easily. Um, she's also having some nightmares, horror nightmares. She shouts in the middle of night. She has lemon craving and she is feeling insecurity and low confidence also. She wants love and attention from all the people she loves. So she said that hugging her and cuddling her will give her amelioration and she'll be at ease at that moment. Cares and worries concerning the others. And claustrophobic. She explained the claustrophobia about how she feels suffocated when she is in the crowd of many people. She said that she can't breathe when she is being crowded by the people. And sleep paralysis. She said that she can't move her hands and legs during her nightmares. And she likes the specific colors like blue and green, and her parents complained about her compulsion behavior, like sometimes she's being so much fastidious and so much of neatness, and sometimes she'll be like untidy and messy. She'll sit in the corner and be like that even the room is messy. She keeps on eating when she is stressed out, and she asks for fast foods or junk foods during when she is stressed out. She'll be hearing repeated songs and continuously she keeps on the headphones and she'll be isolated. When she wants to say something and there are no audience for her, she goes on writing what she wants to express. Or sometimes she, while doing the work, she'll be talking to herself. Or when she seeing to the TV, or when she's talking to the people. On other side, she'll also do the work of picking the skin or biting the skin of fingers. So she'll become aggressive and argumentative during her premenstrual syndrome and weeps easily and hurts easily before the menses. Sometimes she'll lock the room and she'll come back and check repeatedly. Frequent urination for at least 1 hour, she'll be going every time to the urine, and sometimes to be making her decisions come true, she'll be having the sense of cutting her fingers or cutting her skin and blackmailing. and she likes to touch the soft things. So she says that everyone is seeing her attitude, or everyone is seeing that she is not attending their calls or messages, and they are complaining about her aggressiveness. But as a doctor, we have to see what's happening with her during her complete age. And since the childhood, I asked about her, what happened to her. So she says that her parents are little strict, and she doesn't remember probably like too much laughing or too much enjoying in her childhood. She used to be like a depressed and sad girl and sitting over the corner from the childhood itself. So I asked her what happened in your childhood. So she says that one time in school she had an annual function. So she gave name for the dancing, and when she came for the rehearsal, her friends have laughed at her and the teacher rejected that her movements are not good. So there is a first conflict she has faced, that is in early childhood itself. So after that, what happened? She hated school and she started enjoying her little bit holidays with only her relatives. So she said that there are five girls in a home. There are five sisters. So there are no brothers. So in relations, there are brothers to her, cousins to her. So she used to go to holidays for the village and she used to play with them. So her childhood in village is very good instead of the school. So she doesn't like to go to school and doesn't like to attend the classes also. But the enjoyment is in her holidays only. So what happened after a little bit growth and she entered into the fifth standard or something? She's being going to hostel. She was thrown into the hostel, and the hostel, she said about the hostel that the hostel is very much terrified, and she faced that um, hostel people are not too good and not cooperative. She is so much timid, and her she has a little more things than her schoolmates. So the people used to theft her things and destroy her things like her trunk or her bucket or mug. They used to destroy those things, and she used to feel depressed about being in hostel. So after 1 year or 2 years, she came back to home. She left the hostel because she couldn't survive there. Mm. During the before she joined in the hostel only, there was a cousin brother who is so much elder to her, like about 8 years, she told. So she loved him so much because that brother showed a lot of love to her. He used to hug her, he used to kiss her, he used to take her to rounds, and she became more comfortable and happy having more enjoyable moments with her brother. So as her parents are very strict, she got very much attached to her brother and being happy at that time. So what happened after a maturity stage, like first menarche, after the first menarche, she entered into like eighth standard or something, which her normal responses of the human being at adolescent age, they will get attracted to opposite gender. So what happened? There is a complaint that she's talking to some boy, so that became more and more stressful for her when she has been warned by her parents. So, what happened after the academic year completed? The boy had left the school without the notice because there is no talks to him. She said that there is no talk to him, but still she had a little crush on him. And what happened the next moment? Her brother had left the home because some issues between the relatives. So she had a conflict, big conflict about the leaving of his brother. So there is a maturity stop of the girl. At the age of 13 and 14, she's being emotionally numb, and from then there is no emotional growth or analytical growth in her. She is just craving for the love and affection of her brother. Now, how she behaved with her brother and how her brother had to care for her. She is in search of such person who used to care her. She felt like there must be a brother who is caring her, because her thought have been so much strong, because after growing and after her brother left her, she has found a many abuses in the society. When she is in 8th standard, and before 8th standard only, they used to have car, so she used to feel secure and there is no touch with outsiders men. After the conflicts between the families and the cousin brother, her parents have sold the car, so she must be compelled to be traveled in bus or auto or whatever it is in the public service, public transportation. So she faced many abuses, touchings, bad touch, whatever it is. She have wept when she told to me about that kind of abuses. So because of this stress, what happened? She got attached a little more to only the family members. But still, she said that there are family members, the boys and the family members, who will be touching her in the intention of something else, which she actually don't know. But she felt bad about that thing. So this mentally affected her foundation and studies. So what happened here? Somewhere she wants somebody who is caring like her brother. So she got attached to a relative, and she used to talk with him. After the joining in graduation, because that she is being busy in the phone, her friends used to mock at her and isolate her, and they used to isolate her bed also. They used to be one separately, and they used to separate her bed. So what happened here? She used to get many horror dreams, and she used to feel so much scared there. So after completion of her graduation, she was in stress and she got a fight with her friend. A fight with her friend, so they got apart. And slowly she got attached to other person whom she find that the person might take care of her, and she used to feed him financially and taking him to restaurants, and whenever he want money, and she used to give him. But the man used to mock at her body, and he used to do body shaming of her. So this is another big conflict she has faced. And then she joined in the job where she felt the financial crisis, and she took the responsibilities of home. She want to build a new home to their parents. So there, her income and her dreams, there was a conflict. She felt that her job was not up to the mark about her salary. So after that, what happened? She got marriage proposals, and during the marriage proposals, she got many rejections. She got being rejected, and in this duration only, she got attracted to the person who is unknowingly a Casanova. She don't know that the person is a molester. The person is a Casanova. So she got attracted to him, and suddenly she'll know about the person that she trusted him blindly. So between these things, there is a good attachment to her. She said about the person who is taking care of her. Her colleague is taking care of her, and but there are still conflicts between them because she is trusting blindly somebody, and she's being cheated always. So he used to guide her not to easily believe in anybody or think about the society. So what she said about her parenting is, her father and her mother, both of them are very strict, because I little bit asked about their parents personally, what is their lifestyle. So her mother, they are also complete sisters. They don't have brothers. So she grown up in a tight environment where their parents means grandfather is also an employee, but still she has grown in a restricted area, And about her father, he is also an educated man, but during his some 20s or something, because of financial stress or about money stress or about educational stress, he is also being conflicted somewhere, and because of rejections also. So these things make up those persons, and in turn they will be keeping the pressure on the child. So in nature, Dr. Hammer says about the alpha and beta animals, which means that who are strong will be alpha and who are weak will be a beta. So here her parents are alpha male and alpha female, and the baby becomes the beta child. And she has been in submissiveness by the parents' strict behavior, and her childhood is like a primary depression. Slowly, when her conflicts have been improved, she went into the manic depression state. So these are a conflict she faced, and according to Hammer, I'll say you the what is a conflict. At age 5, she has been rejected in the dance and annual program that is directly acting on the mesoderm, which means the self-devaluation conflict. At the age 12 and 11, there is a separation conflict from the home, family, and she went into the unclean hostel. So there is a separation conflict which is on the skin, which acts on the skin, which developed from the ectoderm. So she used to get a small eruptions on her fingers when she is in the hostel. So that is scabies. And a marking conflict. She used to say that teachers won't send her in between the periods, teachers won't send for the urination. And because of unclean hostel sewage, she used to stop her urination, and she used to not defecate for 2 3 days continuously. So about the marking conflict, she used to have the urination, compulsive urination, or frequent urination. At the age of 14, there is a loss and a separation conflict from the brother and the classmate. That is a loss conflict which is um, developed from the new mesoderm, which is affecting on the ovaries, where she got the menarche stage. So she used to get dysmenorrhea regularly. At the age of 15, parents became more strict because she has become uh, attained the menarche age. So the girl has grown up. She should be careful in the society. So parents have been very much strict about her movements or her way of speaking, and they used to restrict not to speak to anybody. So that is a motor or stuck conflict. That is self-devaluation conflict about the mesoderm, where the bones and muscles are developed. At the age of 16, there is a molestation by a lot of people in different circumstances. So she explained about the travel in bus, the travel in autos, etc. That is a conflict of bite conflict and attack conflict, and sexual conflict or touch conflict. She explained about what she faced. So she says that when she is sitting in a bus, the the man who is sitting in the side of her bus, side of her seat, he is constantly touching her mummy. So she felt so much comfortable. The touching of mummy or touching of thighs or something else, even it is a bus or something. So that is a very bad memory to her. So at the age of 17, difficulty in studies after remembering all these things. So she is being insisted by the family members only. So this became more conflict to her. There is a misunderstandings between brother and also classmates. There is a territorial conflict and separation conflict which are arising from the cerebral cortex. Age 18, the failure in cracking the competitive exam, that which involves the bones of her hands, and that is self-devaluation conflict and attack conflict by the parents. They used to yell at her that you're not studying, you're not studying, you're not studying. Age 19, somehow she has entered into the college time, so she got seat somewhere in other state. So she has to get separated from the family and she has to go there. So that is next worry conflict and scare fright conflict when she got separated from the family. So she said about the scare fright because she used to sleep in one room only with her parents. So always there used to be the protector behind her. So there is no fear. But after entering into the college, so she said about how she felt alone in the college. There is a long distance relationship who she used to speak to him continuously. So there is a territorial fear and identity conflict of not being understood. At age 23 of the completion of her degree, so she said somehow her friends left her and went back to the college because without information, without giving information to her. And she said that her academics have been completed and there is a delay in getting the certificates. So she used to have a lot of fear about her completion of her degree. So there is a loss conflict and self-devaluation conflict. At age 24, there is a loss of love and disturbances in her expectations. So the man she loved, used to always body shame her, and when she joined in the office, there are many insults and attacks by the employer that she is of no use. But instead of the words explained by the employer, she says that she gave more work to the employer. So that are multiple attacks at the age of 24. So there are different attacks during that time because of marriage rejections and financial troubles. So she had the starvation conflict, identity conflict, and stuck conflict. At the age of 22, she at the age of 25 she found a person who is loving her and who is taking care of her, but she got being neglected by that person because she is being a childish always and she's being trusting somebody who is always trying to take advantage of her or being benefits from her. So he has been trying to explain her by neglecting her, but this made her more depressed because of these things. She had got scare fright and territorial loss conflict and sexual conflict. She trusted a molester blindly, so she has little fears of what he is going to do her. So this is a frontal fear conflict or powerless conflict. So at present, after our GNM explanation and realizations, she got complete realization about her inner self, and now she is loving the people without written expectations. So in terms of GNM, this is the endoderm. From the primitive organs, there is only endoderm. Slowly after evolution, the mesoderm have been developed and the ectoderm. So there are certain organs which are originating from the endoderm, like lungs, alimentary canal, uterus, and prostate, which are being controlled from the brain stem. So the conflicts from arised from the organs of the endoderm are death, fright conflict, and muscle conflict. So what happens here is the organs which are under control of brainstem in conflict active phase, there is a cell proliferation to resolve the conflict. So after the conflict has been resolved, in the healing phase, the cells are not required. So the fungi and bacteria, which are our friends, right? So the fungi and bacteria will be removing all the cells. So in mesoderm, the organs which are developing from the old mesoderm are corium skin, pleura, peritoneum, and pericardium. Like pleura is the covering of lungs, and the peritoneum is in the stomach, like abdomen of organs covering of the abdomen, and pericardium, which covers the heart. And breast are also included here only. The mammae are also included here only. There is an attack conflict. And in conflict active phase, there is a cell proliferation. It means that many cells are being divided and divided. So in order to resolve the conflict. In healing phase, there is a cell removal which are not more required. In the new mesoderm, there is a development of bones and muscles. So these are all organs which are developed from the new mesoderm. Striated muscles, bones, tendons, ligaments, connective tissue, the lymphatic system, and the blood vessels. So the conflict of the new mesoderm is self-devaluation conflict. The self-devaluation conflict here of the girl is she has been mocked and insulted and being warned by her parents and the friends and whatever she faced during her college or school. So because of that, she got self devaluated and she says that she is not beautiful. She used to always make her low. So during these things, there will be a cell loss in the conflict active phase, and in the healing phase, there will be a cell restoration and cell development in the area of necrosis. So this is with the help of fungi and tubercular bacteria again. And the last, the ectoderm. Ectoderm organs or bile duct, pancreatic ducts, milk ducts, and also the linings of the cervix of the uterus and the bronchial tubes and the heart vessels. The conflict regarding the ectoderm are separation conflicts, sexual conflicts, and the territorial conflicts. There are many territorial conflicts. I'll say the further. During the conflict active phase, there are cell loss. It means the ulcerations. And the healing phase, there is a cell restoration. So I think I'm clear here. So this is the cross section of the brain, and I have merged all things together. So there is an area on the left side known as the female conflict area where the estrogen levels will be maintained, and there is a right sided male conflict area where the testosterone levels be maintained and function. So these are all relay centers of different parts where you can see. So laryngeal muscles and laryngeal mucosa is on the left side, and the bronchial muscles and bronchial mucosa are on the right side. So regarding the girl, so she has problem with the marking conflict. So this is the area of bladder where she is getting frequent urination. For example, this is the right side of the bladder and this is the left side of the bladder, right? So these are all two conflicts, I mean multiple conflicts which are turning into the constellation and constellation behavior. So the female conflict area with the normal hormonal status of estrogen will always be in a manic state, and with a low estrogen level, she'll get into the depressed state because the low estrogen levels means the testosterone level is high in the female. So automatically she will enter into the depression. And if the male with a right-handed person, if he is having the normal hormonal status of testosterone, he'll be always in a depressed mood. But if the testosterone levels are low, he will enter into the manic state. So opposite side, when this is based on the scale of the hormonal status. So if there are normal hormonal status in male or female, the female side is left. So this is normal hormonal status of the estrogen, and this will get opposite in the left-handed persons. So there is a law of polarity. This is a universal law of polarity. The nature of testosterone is always ferocious. It means that he'll be ready to fight. Wherever you see in the universe, whatever the animals, the male is having the duty of protecting and fighting with other males to protect the children and also is female. So the masculine energy represents decision, protecting, action, mind controlling, focus, and power, representing and implementing. So these are the qualities of masculine nature. And about the feminine energy, the estrogen nature is always calm, creativity, receiving, intuition, and devotion. Forgiving nature, the female has a forgiving nature always. And community, inspiration, and healing. She'll have, my guru says that females have to travel towards the brain because female always thinks from the heart, and the male must be traveled towards the heart because he will always think, his thinking will be always regarding the brain. It means what he has to do, what he has to earn, how he has to fight in the society. So this is the nature of male. And femininity nature is a calm and protecting the family within the territory. The female means within the territory, she will take care of her children, her family, her man, and she'll have more patience to look after them. She'll be feeding them, she'll raise them, and the man will look outer the boundary of the territory. He'll be protecting from there, the outer boundary. So, what are the constellations? Regarding the girl, the patient whom I'm explaining now, there is a constellation of cerebellum. The cerebellum constellation is being emotional numbness, and people in this constellation feel void inside and emotionally disconnected from others. The cerebral medulla constellation, she is always craving for the attention, approval, praise, and admiration because her brother used to always cuddle her and take her to the trips and wandering desire. So he gave more comforts to her so that she is having the loving nature only. She said that her parents never used to uh, feed the negative things regarding anybody to her, regarding the relatives or outsiders. There is no negativity teaching from their parents, so she is having always a loving nature and she is being a craving for that nature of people. For exceptional achievements academically and intellectually in arts or in the professional career, to protect the individual from further self-devaluation conflicts. Bite constellation, obsessive skin picking, inability to bite or snap an opponent or to defend oneself, being in a weaker position, vice versa, a parent, friends, and molesters against the authorities. So, as per her conflicts, so she has a skin picking habit of being inability to bite the opponent. The motor constellation, feeling stuck at school, being teased and bullied by her friends, and she hated her school. There is a stuck conflict in the family situation also, where the parents are much strict and they used to restrict her not to talk with anybody, like mainly the opposite gender. She is a girl, so she should not talk to the male. So there is a stuck conflict, and there is a compulsive touching of like she wanted to touch because she's missing the touch of her brother, so she always want to touch the people, and she gets calm. Maybe that is not a bad touch. She says that her intentions were not bad, but she has a compulsive to touch. Excessive cell phone use because she's being lone or feeling lonely. The claustrophobia, a fear of having no escape or being trapped in an enclosed, fear of crowd. And Broca's area, which has speechless conflict with the fear. After the being bullied in school, she has become calm and she never have given a stage performance, or she never went into the stage. The post-sensory constellation, the short-term memory loss, being inattentive and easily distracted. The purpose of short-term memory loss is to block out the memory so that the individual is better able to cope up with the separation. So what happens here, she will be sometimes dreaming, like staring somewhere and being inattentive. So this, what this constellation helps to the people is to separate the memory which she has been had the negative feeling. So that is the purpose of the post sensory constellation. And the temporal lobes, she is having the low mood, passive nature, introverting nature, listless, sadness, incapable of experiencing joy and pleasure. And manic depressive mood, the cycles between the mania and depression. The premenstrual symptoms, argumentative nature and addictive behaviors. Like if she feels comfortable with any person, she'll be addicted to them, and she always wanted to be around them. There is a maturity stop. Maturity stop is also because of the conflicts registered in the temporal lobes. So emotionally, she behaves like a 13 years female only till now, but only there is a physical development like according to her age. Sometimes she used to say that she used to have a suicidal thoughts, but not to that extent because of the territorial loss conflict and the mate conflict. So the thing, nympho constellation, understanding the compulsive female sexual behaviors. The woman who has lost a mate or has been sexually rejected. She has been rejected in many marriage proposals, and from the childhood she has lost different people where she used to find her brother like behavior, but instantly what happens, she is not their people, so they'll be leaving her constantly. So there are many rejections and losses. So with the maturity stuff, the behavior of the girl is like a nympho, which she'll be compelled to ignite a man, but she only wants to cuddle or like having talks or cuddle or touch, but really she doesn't want to have sex. So she was clear about this matter that she only want to have the cuddles, right? And the aggressive behavior, aggressive constellation, she has an urge to argue. There are a sudden aggressive outburst and fits of anger and rage, loss of control, and lashes out and becomes destructive. She has a habit of throwing things and breaking down the things, and she has the self-injury nature. Like she used to threaten the people with blades or knives. So this is intended to threaten or harm the other people emotionally, right? So, flying constellation, postponing the task and being lazy. So, she used to be active during her academics, she used to be creative and she used to be helpful to the friends and also to the lecturers. But what happened during the course of time when she had joined the job? So she used to be insulted by the employer. So what happened? She used to be so much depressed and she became too lazy now. Once she used to be very much active and very much neat and clean, and suddenly it turned up. So these now she says that she's being messy and untidy, and she used to have dreams like going in the air and flying in the air, and sometimes she used to be falling down. So there is a manic state. You must understand what's the mania. There is a manic state. The dreams will be coming like lifting up and flying, and when the dreams are like falling down and losing of hair and teeth falling, that is a depression state. So the dreams of falling comes under the depression state. Feelings of dread, sweating and rapid breathing and fast rate and gasps and screams. So these are all sleep paralysis symptoms which are included in the flying constellation. She says that she used to scream out in the middle of night after the different kind of dreams, horror dreams. And mytho constellation, the persistent urge to talk to self. Here, what's happening to her? The friends, she used to think that they might be with her for lifetime and care for her, but what happened? They used to mock at her and bully her and leave her. So what happened suddenly when she found a person, true person, and always she's being trusted other men. So the person has uh, made her understand and kept her for a while away. So what happened? She used to feel depressed and she used to talk to self. What she used to mentally prepare. She'll be mentally preparing what she want to say to that person. So that she'll be expressing in the papers or in the charts like long conversations. She used to write long diary entries, or she, when doing the work, her lips used to constantly move. Means she used to talk to self what she must express to that person, that how she's being attentive towards him, or how she's attached to him, so how she is so much need of him. So this is a persistent urge to talk, the mytho constellation. And the autistic constellation, autism symptoms, not exactly autism what the diagnosis is making outside. The autistic constellation means the behaviors which the person is having by the conflicts where they are facing from the childhood. So the compulsive perfectionism, she, if she starts any work, or if she starts any diagram, she goes on sitting on the hours and making the tiny tiny details, and making the problems until they are solved, making the high demands the persons around her, in the parents maybe, the sisters, and her colleagues or somebody. She has a tendency to argue, and she always keeps her surroundings clean, and she's highly ambitious and focused interest in certain knowledge. So this is dwelling on the solving difficulties tasks. This is known as a creative worrying. This comes under the autistic constellation. The marking constellation, there is a compulsive urination. She'll go to urination before the exam, she'll go to urination before the trip, because she has a constant fear that there is an incontinence of urination. So this must be like to void the bladder and become light, so the heaviness will be removed. So the natural stress reaction, because a part of fight or flight response, to eliminate the waste as quickly as possible. The bulimia constellation, compulsive eating, binges, overweight, arguments with family members, emotional neglect by the loved ones, loss of a close friend, losing one's first love can also prompt the identity conflict of not knowing where to belong. The frontal constellation, obsessive fear of what is ahead, feeling of uneasiness and apprehension concerning future events, anxiety attacks, and fast heart rate and rapid heartbeat. So, the different kinds of responses she had are controlled from the limbic system. The limbic system is part of the brain that deals with the emotions. So, here you can understand her emotions. So, these part of the limbic system which are dealing with the reward related attraction. So, that is on the right side. It is also controlling the appetite and also for the aging. So instantly when she believes that somebody is going to take care of her, so she'll become close to them, and when she's being with them, her reward related center is being active of the limbic system of the amygdala. So the particular diagram is about amygdala. So left side is about the fear and aversion, and it is about the aversive nature and defensive nature. So these are right side and left side of the amygdala. It is concerned with the emotional and behavioral functions, the immediate, strong, effective reactions of fear, anger, and emotions of sexual behavior. So the girl is mostly being in the active limbic system and sympathocotonia state, the lasting sympathocotonia state. So all the symptoms of sympathocotonia, like fast heartbeat, or everything what she has said, the urination and the sweating and the rapid urge to argue, anger, all these are the symptoms of limbic system only. So the main areas of the limbic system are cingulate gyrus. It plays the important role in cognitive functions and emotional processing. the thalamus and the hypothalamus, the amygdala, basal ganglia, and the hippocampus. How do you find the person's constellations? So the constellation is also originating from the Dirk-Hammer syndrome, the conflict, and they have a brain and organ correlation too. The role of the brain, generally, the brain is having two hemispheres which are in synchronizing of rhythms. But what happened in the constellation? They are both hemispheres are out of synchronizing. The two conflicts can occur simultaneously or in a sequence, or a person can suffer at once two conflicts of the same nature. A constellation can be brought on when the Dirk-Hammer syndrome has two aspects. The constellation can be permanent or recurring due to the tracks or conflict relapses. The manic and depressed moods or manic depression only develop with the temporal lobe constellation. In constellation, a person in the double sympathicotonia state, that means nervousness and restless. Conflict resolution. Once one of the conflict is resolved, the person is no longer in the constellation. Subsequently, the mental state and the behavior return to the normal. At that point, the corresponding organ also goes to the healing, causing the constellation can be the permanent or recurring due to the tracks of the conflict relapses. The estrogen level is regulating from the left temporal lobe of the female conflict area, and the testosterone level regulated from the right temporal lobe of the male conflict area. The person's biological handedness and whether the conflict or mother child or the partner related depend on the side of the brain of the conflict is registered. The constellation is established the moment the second conflict impact the opposite side of the brain. The conflict could also occur simultaneously. With the left-handers, the conflict is transferred to the opposite brain relay in the other brain hemisphere. The scale rule: with the greater weight of the conflict activity is on the left temporal lobe, the person is manic, and when the greater weight is on the right temporal lobe, the person is depressed. So when the patient is in the lasting sympathotonic state and aggressive behavior and depressed behavior, then the prefrontal cortex, which is crucial for decision making, won't make the decision, and the amygdala immediately react to the signals received from the outside and it releases the adrenaline. What happened to the triggering? When she has witnessed something, her brain areas like amygdala and hippocampus will be active. In the fraction of seconds, she'll be reactive. So, due to this kind of behavior, what happens to the prefrontal cortex and hippocampus? These all the areas are tiny neuronal connections and structures. So, eventually, what happened? These nerves get degenerated. The elevated anger hormones or stress hormones will cause the loss of neurons in the prefrontal cortex, which are suppressed activity in the prefrontal cortex prevents you from using the best judgment. So, constant anger and negative emotions will cause the degeneration of prefrontal cortex. So, you can't make the right decision in future, or in right time you can't behave in the right way. The elevated level of cortisol also kills the neurons in hippocampus and disrupts the creation of the new ones. Suppressed activity in the hippocampus weakens the short-term memory. So hippocampus is a memory center. So during the loss of the neurons, your memory gets weak. It also prevents you from forming the new memory properly. So when the cells are degenerated, your old memory will be vanishing and also you can't remember the new things. So these are all side effects of anger. I mean, the effects of anger. How stress hormones will affect your body. They will increase the heartbeat, they will increase the BP, and when these symptoms become chronic, the blood vessels become clogged and damaged. The immune system, the thyroid function is also being damaged. The number of natural killer cells will be reduced. It means the immune system is being weak with the anger. And the digestive system, your metabolism gets slow and you'll get constipated and your system won't work properly. In on the bones, it is affected like your bones get weak and porous like a duster. So there is a weakness in the bones also. So just now I was speaking about the hippocampus. This is a memory center. Right? The function of the hippocampus is responsible for the learning in an individual. The lobe is responsible for the major areas of memory. With one study concluding the hippocampus is responsible for organizing the memories into timeline, and other concluding that it is involved with both short-term and long-term memory. So all the lobes of the brain connectedly work, but hippocampus is mainly related to the memory, and it appears to be involving in the deciding the relevance of input for the survival, and provides drive to cause the translation of short-term memory to the long-term memory. The consolidating short-term memory to long-term memory, its subculum as well as the hypothalamus process establishes and retrieve the short-term memory. The hippocampus converts the short-term memory to long-term memory via term potentization, which allows the alternating strength of connections in neurons. So key role of process of cognition, formation of recall of the spatial memory, and memory of information about one's environment and surroundings. So you are going somewhere and you will have the calculation of it is about 1 kilometer and it is about 2 kilometer. The book is of a feet distance and your pad is of 2 feet distance. So these things are being calculated by the hippocampus, critical for effectively combining that what, when, and where qualities of each experience to compose the retrieved memory. So, the stimulation of parts of the hippocampus can elicit the pleasure, happiness, and rage, passivity, or excessive sex drive. So, how the memory is being stored in the brain? So, by the process of learning. So, what is the learning? Learning is defined as process by which new information is acquired. It alters the behavior of the person on basis of past experiences. So here, what the girl have learned, she only learned how to love, but she didn't learn how to hate the people. So because never parents have told how to hate the people, they they didn't share the knowledge of there are bad people, these people have did like this to us, and always saying bad about the other people. There is nothing in there. So there are learning of only good and loving nature only. So there are different types of learning: non-associative learning, associative learning, and watching others. So after the further division, the non-associative learning is based on the habituation and sensitization. Habituation is when our behavioral response to the stimulus decreases. It means that once there is a stimulus, your brain will record it, and habitually when the stimulus is repeating, so it becomes habituation. And sensitization when our behavioral response to the increased stimulus. So the human memory is divided into sensory register, short-term memory, and long-term memory. From the environment inputs, like from sensations of hearing, vision, and touch and taste. So these are the informations received from the outside. So these informations are sent to the brain through the senses, and they are recorded as a short-term memory. Then they will be converted into the long-term memory. So long-term memory is further divided into explicit memory and implicit memory. And these are all the further divisions. So memory is ability to recall the information or any other past experience learned by us before. So what you have learned is more important, and what you're storing in the memory is more important in anybody's life. So this is how the hippocampus and amygdala are working together. So based on the memory and a response, there is a quick reaction of autonomic nervous system. So the autonomic nervous system is described as a based mainly our normotonia, sympathotonia, and vagotonia, explained by Dr. Hammer, is working on the autonomic nervous system. So when a person is in a cool and calm state, their parasympathetic activity and parasympathetic nervous system is very much act, cool and going in a normal way, that is normotonia. And in vagotonia and sympathotonia, the activation of sympathetic nerves, it means that your sympathetic nervous system is a network of nerves that helps your body activates at fight or fight responses. So this system activity increases when you are stressed and danger physically active. So when the girl is being yelled, and when the girl is being molested, and when the girl is feeling depressed, so this sympathetic nervous system is being active. So I'll say a little example which I have seen in our clinic. So there is a lady of 40 years, which she came to our clinic by her husband. Her husband is facing the renal failure. He is on dialysis. So she said he first, as when I spoke to the person, male person, he has a conflict of sexual conflict and territorial conflict. So what is a sexual conflict here? The being love marriage, the girl doesn't allow him to do intercourse because she has terrors and fears about the intercourse. So the girl is always in the sympathogonic state. So when it comes to the male, if the male person is indulging in the coition with a sympathetic nervous system active, he will ejaculate very quickly. So there is a chances of infertility, and when the complaints of sterility and infertility are coming, you must think about that the person is in a sympathotonia. It means that sympathetic nervous system is so much active, so there is a vaginal contractions, that means the vaginismus, the female is being so much painful during the coition, and the male is experiencing the quick ejaculation or no erections. Only when the parasympathetic nervous system is active, it means when the person is being calm, both female or male is being calm, then only it will promote to the erection of genitalia in male and the erection of genital like clitoris in female. The parasympathetic nervous system predominates in quiet rest and digestion conditions. The main purpose of the parasympathetic nervous system is to conserve energy to use for the later and regulate the bodily functions. So during the terror and flight or fright response only, the sympathetic nervous system is being active. So how the autonomic nervous system is being working? So there are quite small chemicals which are released from nerve to nerve. Those are known as neurotransmitters. These neurotransmitters will carry the chemical signals, that is a potential, action potential, from one nerve to the another nerve of the target cell. That may be a muscle or a gland or another nerve cell. So there are different types of neurotransmitters, amino acids on the chemical basis, amino acids, peptides, and biogenic amines, and acetylcholine. So examples of these, some of the examples of these are vasopressin, so neurotensin, and you can easily identify the dopamine and serotonin, which are happy hormones, and norepinephrine. So these are the chemical messengers which are transferred from one neuron to the another neuron at the synaptic cleft, right? So they will regulate us to sleep, maintain the homeostasis. That means the thermoregulation and the signaling and the memory, cognition, pain, and emotions. So the normal functionings are being maintained by these neurotransmitters. So you can see the nerve cell, the cell body, the nucleus, and the dendrites. So this is the axon. So the other cell and this cell are connected, and these are the synaptic cleft, the signals where they are passed. So the action potential, the sequence, you can see here how this. action potential is entering into the neuron, I mean one nerve cell, then it will be transferred to the another nerve cell. Those are the channels where the different minerals are, are being gated or channeled. So few examples of neurotransmitters and their functions. The adrenaline, which is used for the fight or flight, so it is produced in a stressful event or exciting situations. It will increase the heart rate and blood flow, leading to the physical boost and heightened awareness. The noradrenaline concentration neurotransmitter. It affects in the attention and responding actions in the brain and involving in the fight and flight response. It contracts the blood vessel and increase the flow. So these two things are released in the limbic system, like amygdala, during the stress response only. If the girl is feeling awkward or she's feeling bad during anything, then her adrenaline and noradrenaline are released more. And dopamine and serotonin, they are pleasure hormones and mood neurotransmitters. The feeling of pleasure and addiction moment and motivation, people repeat these behaviors leading to the dopamine release. So regarding the patient, I'll give an example. She says that when she spent time with her sisters and when she spent time with her love, so she'll feel very much happy. So in turn, what she tries to make, she tries to go with them outside, she tries to eat the good food, so the dopamine is released. That is a reward hormone, no? So when she is spending some time with those loving people, so her dopamine will be very good. And the serotonin, it contributes the good digestive system, good sleep, and it is affected by the light exposure. The GABA neurotransmitter, which is calming effect, calms firing nerves in the nervous system. High levels improve the focus, low levels causes the anxiety. Also contributes to the motor control and the vision. If she is trying to throw the things away, then it means that the GABA neurotransmitter is very low. It means that her prefrontal cortex is not being working properly. She is unable to wait for a minute and think about what she is doing. It means that her calming neurotransmitter is low. So she, in the spark of anger, in the little fraction of second, she'll throw the things or she'll cut her hand. So these things is because her GABA is low. And acetylcholine, the learning neurotransmitter involving the thought, learning, and memory, activates the muscle action in the body and also associated with the attention and awakening. So this helps in learning different kinds of things from the society, and her parents or her sisters or colleagues, her employer who is teaching her. So acetylcholine is a learning hormone, and the glutamate, it is a memory hormone. So she said that after she got introduced to the person who is loving her so much, so she said that she has learned many things like being calm, being like mature thinking, what to believe, what to not believe, how to behave, how to be calm. She had learned many things from the person who she had loved. So the acetylcholine is released when she is being attentive and seeing the person and listening to the person she is loving. So then the acetylcholine is being released and she is being in the learning process. And the glutamate is a memory neurotransmitter, which what she have learned is being prepared to the short-term memory to long-term memory. It being stored. The most common brain neurotransmitter which is involved in the learning and memory is glutamate. It regulates the development and creation of the nerve contacts. So from one cell to another cell, the information is being carried. So there is a memory neurotransmitter. And endorphins, the euphoria and neurotransmitters, it means the excitement during the sex or producing well-being, the euphoria, reducing pain, biologically active section shown. So the euphoria means the state of heightened pleasure mode or heightened happiness mode is endorphins. So what your body must release? The dopamine, serotonin, endorphins, and GABA, acetylcholine, and glutamine. So these must be in a very maintained level, but they must not go down. So the adrenaline and noradrenaline, they must not grow up, they must not increase more, because they will destroy your normal function. So what happened to the girl during that age of 13? So that is that Dr. Hammer explains about the maturity stop. Why certain people behave like a child even they are grown up. So when a person is still in the developmental age, she experiences a conflict that created a constellation. There the maturity stop at that time when the second conflict had took place. When her brother left at the age of 13 and 14, she had the growth stop, means the emotional growth stop. There will always be a discrepancy between the intellectual world of an adult and emotional world of a child or adolescent. It means that the 25 years female, when compared to this patient and the other people are being so much like commercial or so much attentive or organized, so they won't believe easily, or they are not in search of other person because of maintaining her happiness. But the girl, she has lost her brother and she has lost that there is no particular mate to her, so she has a stop of maturity. It means emotionally, so that is called as maturity stop. With a conflict resolution after the age of 23, the manic depression state, the behavior of aggression or throwing things or cutting or everything has stopped, because she has grown and she has seen, learned from the love. So there is a conflict resolution. But the maturity stop, however, stays and becomes a part of the adult personality. It means the loving nature of her or seeking love nature, both have been uh, in like going running side by side throughout entire her life. So the conflict lies is after being introduced to the certain person or her love, the true love, she said that her conflicts have been slowly forgetting. So this is known as conflict lysis. It is not without a reason that the Spanish called the new medicine La Medicina Sagrada, the sacred medicine. Dr. Hammer says we have to resolve our conflicts twice, in real terms and also in spiritual level. Learning GNM not only allows us to become aware of our individual conflict as a cause of an ailment, it also puts us into the fortunate position to welcome free from fear the healing symptoms. You have to be brave enough to heal yourself when it hurts. Conflict lysis means the resolution of the conflict is turning point of the biological special program. The conflicts always originate from the real life circumstances brought on, for the instance, by the problems like separation conflict, sexual conflict, loss conflict, territorial conflicts, which they are faced by spouse or parents or family members, relatives at workplace. So they have to resolve by themselves. We in GNM terms, Dr. Hammer has said a practical solution of picking up an old hobby, a good hobby, or a territorial anger might have required a move. So sometimes what happens, the conflicts have been resolved when something gets more priority. So she is able to the patient is able to forget the things which she has got molested at the age of 14, 15, 16, 17, or till 23 years. So she is getting slowly resolving them by the attachment of a new person and learning many things from him. So on a spiritual level, conflict we are facing or an invitation to reconsidering our attitude. So she has slowly changed her attitude of being seeking for more attention or searching for true love of brotherly lovehood, because she came to know that nobody is real or nobody really be wanting her to. She got letting go of her anger. She has a view of the situation from different angle. So Her mentors or the elder people also made her understand that this kind of things will happen at certain age, so she must be attentive. So she had learned many things. She said that she used to keep listening about spiritual masters and their videos. So, practicing the forgiveness nature and loving kindness is a true source of healing. When your mind becomes ease, your hormone levels also get balanced and your brain organ works in an harmony. So, a little information about different areas of the brain. So, how you can teach the people, children, and from the day one throughout their lifetime is like you must have an idea about the brain and different lobes. So this is balancing and coordination area of cerebellum at the age of birth one, at the age of one. So let me move. So this is about the coordination of legs and hands, and the area of brainstem is about breathing and heart rate. The visual lobe, the visual processing and the language of touch, and this is about the thought, memory, and our behavior. And hearing, learning, and emotions is about the temporal lobe. So you can teach the kids from the early childhood age only not to fear about the virus or bacteria or anything because they are our friends. So don't panic the children from the childhood life only. So this makes completely different conflicts at their brain level, and this will make them weak, and it will make them like difficulty at their maturity age. This makes problem how to behave with their partners after growing elderly. So what are the happy hormones? They are like dopamine, oxytocin, serotonin, and endorphins. So they must be at certain level to maintain our good healthy system. So if the deficiencies of these hormones are there, your brain have the difficulty in concentration, you have a high BP, you have inflammations in muscles and pain in joints, and you have a constipation and indigestion, and your hair is lost, your skin become aged, so your immune system doesn't work properly, and you have a decreased hormone system and decreased sex behavior and improper reproductive system. So your hormones, your happy hormones must be in a normal levels. So I told about the prefrontal cortex. So the prefrontal cortex is about thinking of a higher reasoning and executing the functioning. So this is main important for every life and every human being. So slowly you have to develop your prefrontal cortex function. It means that the functioning is related to your emotional balance. The empathy is ability to see the world through another person's perspective. The way you must see is what is happening in their life and why their behavior is like that towards you. The insight, the inner sense of knowing, the responsibility and flexibility. It is like an ability to respond flexibly. It allows the individual pause and put a space between the impulsion and the action. If you are seeing a burger or a pizza and you want to eat it and you are craving, but you can say, you must be able to say that wait. It means that your prefrontal cortex will must regulate your limbic system. So you must be able to calculate the things and you must say to the limbic system like no and no. So, emotional regulation, attaining enough intensity so that the life has a meaning but not too much arousal for life to becoming chaotic or too little arousal for the life to becoming rigid and depleted. So, you must have a emotional regulation there. You must not feel too depressed or you must not feel too much like arrogant, or you must not be too much in any type of emotion. So you must be in a balanced state. So this comes from the prefrontal cortex and your body regulation. coordinating the different systems of the body to function optimally. One example is balance between the sympathetic and parasympathetic branches of the autonomic nervous system. So this function is from the prefrontal cortex. And about the morality, the capacity to imagine the reason and exact behaviors on behalf of the larger social good, and the intuition. The term denotes the neurological knowing that emerges from the body, especially the neuronal networks in the heart intestine that send their signals upward through the insulas to the regions of the middle prefrontal cortex. So the attenuated communication, the compassionate connection into the relationship. One example is when internal states or focus of attention are attenuated to the such that they become seen by another person. Fear modulation, the ability to unlearn a fear. So here, when the fear modulation, during the fear modulation, I would like to say about myself. So he had made us fear free, and he had made us a perfect human beings to how to resolve the conflicts and how to be emotionally balanced. And during the time of COVID, so the fear modulation, the prefrontal cortex of all our clinic staff had no fear regarding the virus. So we are able to handle many patients without fear. So this function is of prefrontal cortex. When you are so much anger or being depressed, your prefrontal cortex and your neurons in certain lobes will decrease, so that you will not be in a. So see this slide, I would say about forgiving nature, it means the conflict lysis. So the area of brain which is known as prefrontal cortex, it has certain functions like ability to balance the short-term rewards with the long-term goals. It means that some people, mainly in teenage maybe, they will ask for car, they will ask for gold or whatever it is. The too much comforts or too much spending of money on certain things which are really not useful. But they must focus on a study which is helpful, and the exams or whatever it is, the work, at least a physical work which will make them active, which is useful for them in the future. So that is ability to balance for the long term goals, considering the future and making the predictions. So if the person, she or he, is believing something and want to do something, so she must have an ability to think about the future, and she must be able to predict what is going to happen further. And she must have a focused attention and organizing the thoughts and problem solving nature, forming the strategies and planning, inhibiting the inappropriate behavior and initiating the appropriate behavior. So she must not be aggressive, she must think for a while, and she must be calm, she must have to wait for a while, and act certainly. Simultaneously considering the multiple streams of information when faced with a complex and challenging information, foreseeing and weighing possible consequences of the behavior, shifting and adjusting behavior when the situation change, modulation of intense emotions and impulse control, and delaying the gratification. So forgiving means forgive anyone who has caused you pain or harm. Keep in mind that forgiving is not forgetting, because the memory may be removed from the hippocampus or whatever it is. But what happens when you face certain situation again, the amygdala will be so much reactive and you'll behave the same. So forgetting is not the thing, but forgiving is what you have to attain. It means that even when you are receiving or you are facing certain problem again, you must be able to not immediately react with the amygdala and again enter into the sympathotonic state and again enter into the conflict or constellation, but instead you must be in a normotonia by using your prefrontal cortex and being in a normal state. So it is remembering without the anger. It frees up your power and heals your body. mind and spirit, forgiveness opens up a pathway to the new place of peace where you can persist despite what happened to you. So finally, the summary of GNM theory, the GHK theory, for growing children, for a newly married couple, or the for elderly people, we will counsel for them through the GNM principles, like the children, the growing children from the infant stage to the growing stage. These 3 4 years is very much important, like how they'll become strong. The few peoples in this age, their parents will restrict them not to play. They will have threatening them and feeding them continuously, and these kind of behaviors is affecting the people of kids, certainly kids, like feeding them constantly without working of digestive system. There is no response from the digestive system while the parents are feeding time to time, so there is no need of certain things. And you must be able to expose the children to different kind of environment, so he will get his immune system strong, because the plants, the animals, the whole creatures in the world will be reactive towards all seasons. And certain time the leaves are shedding off and the new leaves comes, so same way the body also, there will be a cell loss and there will be a cell proliferation too. So these things you have to keep in mind. So, towards the attitude, we will say to the growing children that they must have the wisdom, humility, compassion, and GNM will give them strength and direction, and how to live in the peace and assurance, salvation, and ultimate guidance of leading life. For the newly marrying couple, we will counseling them by the GNM theory, like they must do everything, but not with greed and not with ego and not with enmity and lust, but with love, compassion, humility, and devotion. If the newly married couple are facing problems in their in-laws' homes, we will say to them that love them, but not expect immediately the result. Someday, in return, they will love you back, and you'll be at peace. So, left to itself, the mind goes on repeating the same old habitual patterns of the personality. By training the mind, however, anyone can learn to step in and change the old ways of thinking. That is the central principle of GNM. Set thy heart upon the thy work, but not never in its reward. So you must do many things. You must do um, works with all your heart and 100%, but never expect the rewards. For elderly people, we will explain that for certain is death and born, and certain is birth for the dead. Therefore, one over the inevitable thou should not grieve. So always having the fear is not at all correct. That will evoke the conflict of respiratory system and etc. The effort never goes waste. If you are being in the right pathway, then there is no failure. Even little effort towards the spiritual awareness will protect you from the greatest fears. So expectation always leads to disappointment, and disappointment gives you more pain, which reflect on your physical body. So no expectation and only loving nature is more important. The GNM also deals essentially with the spiritual foundation of human existence. It is a call of action to meet the obligations and duties of life, yet keeping in view the spiritual nature and grandeur purpose of the universe. I'm very much thankful to my family, which has strength of my meaningful life, and I'm thankful to my clinic world, who really built up my emotional and professional life. I'm thankful to my guru, my Dr. VS Reddy sir, and I'll end this video now. Thank you, everyone.